Hi, everyone. I'm here with Dr. Giampapa today. I am really excited to have him with us. So, Dr. Giampapa is a 2014 Nobel Prize nominee for his pioneering research into cellular restoration technology, a 2016 Gusi Prize winner for cellular aging research, A4M Science and Technology Award for his development of the first computer program to measure aging, and a consultant to NASA for the Space Shuttle robotic arm. He was also recently a keynote speaker at the Second International Vatican Adult Stem Cell Conference in Rome. So if that is not an introduction, I do not know what is. You have a great background, Dr. G, and I would love just to start there. Can you tell us a little bit about your background and how you got involved in the space?
Sure, absolutely. My passion for aging really kind of started um, due to the fact that I've been also a plastic surgeon for 38 years, and that was about 20 years into that. I was just fascinated by how different people age at different rates, and that kind of really got me focused on maybe being able to do something aside from surgery to cover up the effects of aging, but really look at what did we know at that point in time and what could we do in the future to really impact aging. So
Ab-
that's how it started, really.
Yeah, and I think that's becoming a huge trend in today's preventative integrative medical space. You know, it's been coined all of these different names, but you're exactly right. And I think moving on a little bit further into your specific research, what we're really excited about is your experience and background with stem cells and development and all of your clinical medicine work at RMI, and also some supplement design and development. Like I said, you're a man of all trades. You really do it all. So which work that you're currently doing captures your interest the most? Do you have a specific area? Just because I know aging can be so broad. There's a lot to uncover there.
So, one of the areas that is my passion and I believe is going to make the biggest impact on humanity is understanding how stem cells are involved in aging. We're all born with a fixed number of stem cells, and we use up most of those stem cells to arrive to become healthy adults. And that window of perfect health is very brief, really, early 20s to maybe late 30s, because that's when we start to lose not only the number, but the function of our stem cells. And so over the last actually 20 years, I've been actually collecting, storing, and giving back those stem cells that we can now collect through a process that's very similar to basically having an IV in each arm and having a special machine extract those stem cells. So once those stem cells go into cryopreservation, basically where they don't age anymore, we're aging out here, and those cells then can be used in the future, particularly once we hit our 50s, to start to get back and to restore both the number and the function of the cells that we once had. Now, the real issue is the majority of us are older than that 30 to 40, that 20 to early late 30 window. So what do we do in order to like make those cells available to work optimally? And that's where this whole concept of epigenetics and genetics comes in. In 2016, we showed for the first time that we could literally take 80-year-old stem cells and turn them back into 30-year-old stem cells. And we did that without altering genes because that's where the big long-term issue of safety comes in. And
Yep.
we came up with a technique where we put them in what looked like a very primitive bioreactor, old cells, new cells together. And we found out that the compounds from these young cells were able to transverse a special barrier and then go right into the DNA and the cytokines, growth factors, went into the young cells and flipped the gene switches back to a younger point in time. So that allowed these old stem cells to actually work more efficiently. So we presented that in 2016. Now, since then, the technology has advanced dramatically. And that's where our new research is actually, I think, certainly at the forefront. We're right now doing research at a Harvard University and with the Harvard Stem Cell with Dr. Wayne Marasco. He's also at Dana-Farber Cancer Institute because we're looking at reprogramming hematopoietic stem cells, which are the source of our immune function. And even this morning, when we did our research review, we've already accomplished that with without having to do fancy culturing. We actually can do that now with off-label medications. Then the other big thing we'll be doing the beginning of this year is with Dr. David Sinclair. We'll be looking at taking a sample of all three of our stem cell types, the ones that are involved in immune function, blood vessel maintenance and regrowth, and also regeneration. So those three types of stem cells, we're going to actually, we already have the concept down. We're going to prove for the first time that we can reverse the aging process in stem cells, and then be able to, in the very near future, give those back so that our bodies produce younger versions of those and repair and restore our damage, boost our immune function, maintain our blood vessels at much more magnitude of a level that we do when we're in our 40s, 50s, or 60s and beyond. So the reprogramming process, I think, is where the focus of anti-aging medicine, or if you will, longevity and wellness medicine, is really at right now. And luckily, the technologies have arrived, even with CRISPR and other technologies. We can literally reset the gene clock in those cells and make them work more efficiently.
Wow. Absolutely. That is extremely exciting. Just a couple points there. It is interesting that there are researchers out there, just, you mentioned now we have all the tools where we can even do more of an epigenetic based CRISPR type of technology on
Exactly.
top of the genetic CRISPR that we once knew a few years back. And additionally, on top of that, I think you're exactly right. Epigenetic reprogramming is where it's at. For example, they just created Altos Labs, and a lot of those researchers are headed there to with one main purpose, which is how do we set these epigenetic clock factors back to zero? So I think the work you're doing in this field is absolutely outstanding. And we're so excited to talk with you here today. I know you mentioned several projects as well that you have going on. And this is hopefully going to be the first of many interviews where we have you for this Q&A TruDiagnostic research-based session. What I want to focus on today, though, and most people who are listening are going to be very familiar with TruDiagnostic and what we do in this field in terms of research. Right now, we have about 30 clinical trials going on looking at what is reversing those clocks in terms of an interventional pathway. And another part where Dr. G is involved is actually a study we're doing with AC-11. So that is really going to be our topic here today. So Can you just explain a little bit about AC-11, give our listeners a view into what it is and the end goal of that study, obviously hoping to reverse those epigenetic methylation clocks?
Yeah, absolutely. So this goes back about 11 years ago.
Mhm.
We went to the Amazon, kind of like Indiana Jones, and we actually met a group of natives who were using this herb that they got from a vine. And we noticed, our scientists noticed that the people who were being treated with tumors and other issues seemed to be getting healed. And we, after multiple years of studying this, the inner bark of this special vine, we were able to extract a compound from the inner bark that not only had dramatic anti-inflammatory components, but it's the only ingredient that we know of that actually repairs double-stranded DNA breaks. And that's a type of damage to your DNA you suffer from radiation, chemotherapy, space flight. That compound's actually now being tested with some athletes, some astronauts that are going to the new space stations. And so we were looking at this as a potential mode of treating specific aspects that happen inside the cell with aging. One of them is a very important one is the telomeres. Our telomeres are responsible for, they're the biological clock that tell us how many cell divisions we actually have left. And when those telomeres are shortened to a certain degree, the cell stops dividing. So we wanted to look at what was the impact of repairing DNA damage, cutting inflammation down, and potentially creating a therapy for short telomeres. So we did that initial study with a company called SpectraCell for over 2 years. And what we found to our amazement was that virtually every one of the 12 or 13 people in that study had longer telomeres after 24 months. And they should have had shorter telomeres because those telomeres normally would have shortened to make additional cells. So then we decided, and this is where TruDiagnostic's technology and platform is so valuable. We decided to see, let's do a study to see what gene activities actually changed or altered by the use of this compound called AC11. And so I understand today, just from yesterday, we got the data back and it's now being analyzed. And by the end of this week, we're going to start to have some amazing information about exactly what portions of the genome are being activated or deactivated by the use of this compound. So I think, everything we're doing today has to do with looking at the origin of a cell process. And it really all starts at our DNA and how that DNA is activated or methylated or acetylated. And so this is why it's so exciting to work with TruDiagnostics along with this particular project, as well as I think we have two other projects also going on. And without these tools, we really can't peek at what's happening at our DNA, and we kind of look at DNA now as our genetic software, because once we understand the activity, the right profile of activity, what genes should be on or off, we literally could reprogram the processes inside our cells.
Exactly right. Again, all of this talk makes me extremely excited. I think something to know about that response there as well is, again, understanding what genes are being turned on and which genes are being turned off. Because again, in the case of DNA methylation, it's not necessarily always a bad thing, right? People still associate it with the MTHFR gene or the COMT gene.
Yeah.
We're just measuring the expression of genes. So when you mentioned we want to understand that mechanism of action or how the AC11 is actually working, for those of you listening again, we're on the bioinformatics space side. What TruDiagnostic really specializes in is looking at how the supplement is changing those clocks, but we also do a lot of additional analyses, one of them being called a DMR, or looking at differentiated methylated regions. So this is where we'll look at every 900,000 CPG we're measuring and look at the trends to see which positions may be increasing in methylation or decreasing in methylation. And then we'll be able to see which of those methylation markers are tied to which genes. So what is that AC11 actually working on? What mechanism of action, what pathway? So then we get some really exciting information. And I think a lot of these studies, they do answer initial questions, but they typically lead us to have even more questions, right? Which is again, so exciting.
Exactly. So I wanted to mention something new. Recently, we got some data back from TruDiagnostics that looked at two groups. A group that you had already measured their methylation patterns on to see how quickly they were aging or the pace of aging. Mm-hmm. And a second group, we were looking at what were the genes that are involved in aging per se. And that big group that you already had in your database, who were very health conscious people, actually showed that they were aging slower than the average group of people who weren't involved. So that reinforced the whole concept of having a healthy lifestyle. But they still were aging slowly, mm-hmm. But slower than they would have had they not been living a good lifestyle. What was interesting is we looked at our first 100 people at RMI, mm-hmm. and what we found out was that our RMI patients were actually aging slower than that health-oriented group. So this was a major initial trend that we're now going to be following up on a long-term basis. But if we slow the pace of aging, what we're really saying is we're going to slow the appearance and the magnitude of age-related diseases. And that's a big thing. Because life is about living healthier, not just longer, but having maintain your quality of health, cognitive function, physical function. So for the first time, I believe we're really showing them we use a combination of both giving back our stem cells, using certain compounds that can decrease senescent cells or stop their formation, or all of these things together in certain protocols for the first time. We're really showing that we can have an impact on how quickly we age, but also the key genes that are involved in aging. For instance, the Grimm age clock was the other one we looked at. So this was showing the healthy people, although aging slower, were still aging. And again, people using a multimodality approach of restoring some numbers of their cells, senolytics, cennostatics, antioxidants, all were actually aging slower. So this holds promise for the future because I'm sure you're aware of this, but every 2 or 3 months, the information we have about aging and the technology around aging doubles every
Mhm.
2 or 3 months, which means 3 years from now, we're going to have 6,000 times the amount of information we have today. Now, that just blows people's minds away.
Right.
So we are at the cusp of this new technology, and TruDiagnostics, I think, is the leader in giving us this essential information to really look at the origin of aging and the origin of how our cells can actually work longer and better and healthier.
Yeah, absolutely. And I think a couple points to point out there as we're going through this. With our platform and just talking about TruDiagnostic in general, it's going to be backwards compatible and even forwards compatible with that Epic 850K array where we're looking at about those 900,000 positions. Because
Right.
as you mentioned, the information is endless. As new algorithms or new insights come out, we want to be able to apply that to our old data sets and to new data sets that we uncover in the future. So that Epic 850K array is really the golden coin to this type of research. You want to be looking at every single position that there is possibly to look at for new insights. Because again, we don't know what we don't know. We're unleashing more questions as things come up. And I think going back to your clinic as well, it is fascinating the work that you do. Again, you test a lot of patients through TruDiagnostic to really track down the entire aging process. And aging is multifactorial, right? We have to look at it
Right.
from all of these different modalities. So I really liked how you explain, we're giving them this treatment, this treatment, this treatment. It's not the one size fits all that we were used to years back. So I know we've talked about the AC11 study and wrapped conversation up more about that. And that's why we were here to speak. But I think it is worth talking about everything that you're doing at RMI. Can you talk a little bit more about the therapies you're doing on top of the stem cell and if a patient comes to see you, what can they expect?
Sure. So, one of the things that, my relationship with Dr. Sinclair has been able to produce, and I treat people and I do research. So I'm kind of sitting on that fence between both of things. Now, Dr. David Sinclair is like one of the world's foremost researchers. And together, we've been thinking about something very unique. We believe human beings, we all know, have multiple systems: cardiovascular system, endocrine system. We believe that we have missed something very important, that the human body has an innate regenerative system.
Okay.
And we're now actually, that's our focus, is to restore that back to that window when you were a younger person and everything was like you could do anything you wanted.
At your peak, right?
Exactly. So we want to restore that. So basically, we feel the regenerative system is composed of your three types of stem cells that reside in your bone marrow, because we are born with a certain number, and then up until the last 5 or 7 years, you could never get those back. Now we can. The second component of this is actually the origin of what creates that loss is your DNA, because the damage to the DNA rewrites our epigenetic codes or profiles.
Yep.
And the last thing that we realize is really actually a major component to this restorative system is our plasma. So 55% of our blood is that clear yellow fluid. But that yellow fluid, year by year, literally starts to contain and get contaminated with all the things our body's exposed to: the environment, the food, the viral particles that are still there, inflammatory compounds. And the older we get, the dirtier that fluid is. And that also decreases our epigenetic profiles. So those three things are the key components that we feel really make up the human regenerative system. And today we can completely restore the plasma. We can remove it and replace it. We can literally give you back your stem cells and collect and store them. We can reverse DNA damage. And so we're putting all these pieces of the puzzle together that are really going to address cellular aging, health, and we even believe longevity. So when we speak to patients who are coming to us, we try to explain this more complicated science or multimodality approach, but we also really emphasize the need for lifestyle, a more healthy lifestyle. Those two things together are what make a successful program. And for instance, we inherit 30% of our health is really dictated by our genes. 70% is really lifestyle, but both of those things are dependent upon it on your epigenetic profile. So your genes dictate your epigenetic profile, your lifestyle, even your emotions and your stress levels can change how your genes work. So all of this is new science, and everything we learn gets better and better, and we get more and more precise, particularly with the technologies that TruDiagnostics is developing. And I couldn't be happier, because without it, we couldn't document what we're doing.
You're exactly right. Without a objective biomarker, it's really hard to make sense from a lot of the data that you're gathering. And for everyone who is thinking, wow, is my healthcare provider looking into this type of research? Ask them, figure out. I think that's very important. It's your own health, right? It's in your hands. And as you were talking, Dr. Giampapa, I'm just smiling ear to ear. It is all just so cutting edge and very exciting. But I also think it's important to start from the ground up, right? Address those lifestyle factors you mentioned. And you do a great job of encompassing this. So maybe start on things that are in your control, like your diet, your fitness levels, your stress levels, like you mentioned, your how you breathe, even, and your diet as well, and try and get control of those. Really regulate your methylation, and shift those epigenetic methylation markers in your favor. And even on top of that is when you can start to incorporate more of those procedural based components, like the stem cells, the plasma exchange. So I just think that is extremely fascinating. And there's still a ton to talk about as well. So I really hope that we're able to have Dr. Sinclair on next with you, or a couple other people, just again talking about this research, making people more aware of what is really happening, because again, there is so much out there that we need to uncover. We need to let people know the exciting things that are going on in this field. And really, with that, Dr. G, anything else to say to people listening? Any final last words of advice, or anything you want to add?
Well, I think probably one of the most important things is, and I found the most important is,
Mhm.
take a TruDiagnostics test to see how quickly you're aging. And once you see that, it's going to motivate you to either
Yep.
maintain a healthy lifestyle if you are doing it, or really get on track, because you have one body and one life. And basically, with the technology today, you can really take control. You're in control of your future health.
I love it. I love it. Final last words. You are in control of your health, and start early. It's a lot easier to prevent than to intervene when something has already happened. So thank you so much, Dr. Giampapa. I really appreciate your time. Hopefully we'll see you in a couple weeks next time.
My pleasure. Have a great day and stay healthy.